Management of patient at home. Module content. Module outcomes. Aim of the module. Who is caregiver? What are the main needs of our sick beloved person? Tips for personal cleaning. Food and nutritional support. Tips for food and nutritional support. Mobilization. The room. Management of the main symptoms. Tips for pain. Dyspnea. Fatigue. Tips for fatigue. References. At the end of this module, the patient relatives. Gain knowledge of the general information needed to meet the patient's health needs and manage care in the home setting. Learns the information necessary to provide daily assistance to patients and to reach people who need support. Aim. In this module, it is aimed to inform the caregiver about the management of the disease in home patient management and to support them in coping with the burden of care. Who is the caregiver? A chronic disabling illness diagnosis does not only affect the patient but also involves the whole family both emotionally and in practical care. The English term caregiver, a relative or an informal person, literally means the one who provides the care and indicates that person's spouse, partner, or cohabitant in most cases, but also parent, child, brother, friend, or neighbor who assumes the responsibility to take care of the sick person in a disability situation. Most people become caregivers suddenly, without specific preparation for this role. Caregivers should be always trained and guided in this path by the palliative care team operators who can gradually educate them, helping them with adequate resources to better support the loved person. What are the main needs of our sick beloved person? Personal hygiene. A fundamental aspect when a person is sick is personal hygiene. In fact, a well-groomed appearance and a clean body facilitate a better psychophysical well-being for a sick person. Moreover, constant cleaning of the skin is useful to prevent pressure injuries and infections. Tips for personal cleaning. If the person is still partially self-sufficient and can access the bathroom, she can still use the products and personal items normally used. Also, when the person is bedridden, it is important to keep the necessary hygiene items near the patient. Always try to keep the skin as clean and dry as possible. Change the patient's diaper often to prevent the skin from coming into contact with urine and feces. If the bladder catheter is present, always report to the nurse or doctor any skin changes, redness, abrasions. Food and nutritional support. Nutrition represents a fundamental and pleasant moment in each family and social life. Nevertheless, the disease and the necessary therapies force all people around the sick one to change their food relationship, and they often have to give up the pleasure of sharing meals with their loved ones. Often the disease and the necessary therapies can cause alterations and some oral mucosa inflammation that change the flavors and taste of food, but also can cause nausea, vomiting, or a sense of premature satiety, which often lead to anorexia, caused by lack of appetite. Sometimes, the caloric intake reduction and weight loss are linked to significant swallowing difficulties or gastrointestinal diseases that do not allow ingest or absorb food. In this case, it is important that a specialist doctor, nutritionist, assesses whether to prescribe an adequate diet or recommend the use of specific products or to set up an artificial venous nutrition or via gastrointestinal tract. Tips for food and nutritional support. Firstly, do not get nervous and do not be distressed if your loved one does not want to eat, because it is not a whim, it's the disease's fault. Do not prepare large meals, but small portions are distributed in several moments during the day, for example every 2 hours. Educate to chew and eat slowly, then take a nap after each meal. Try to make the food as tempting and tasty as possible, so as to stimulate the palate, for example by adding spices and herbs such as rosemary, basil or mint, but always respecting the patient desires. Take advantage of the good mood moments, in which the appetite is better, to allow him to eat what he likes most, without exceeding in fats, which could worsen the satiety sense. Although this may seem unhealthy, sometimes it is better to indulge the tastes of those who do not want to eat, avoiding relying on alternative diets that are often unattractive. Tips for food and nutritional support. Sometimes you can replace small meals with sweet and tasty nutritious drinks, smoothies, ice cream or yogurt, possibly enriched with food supplements, which are refreshing and leave a pleasant taste in the mouth. If the smell of the kitchen is annoying, you can ask friends or relatives to bring food from outside, or prepare cold dishes that are also inviting. If your loved one does not like sharing family meals at the table because he or she may feel uncomfortable, leave him/her to eat alone and away from any distractions. Anorexia and the consequent weight loss are often the consequence of other specific symptoms, related to the disease itself or to the complications of ongoing therapies, which can create difficulties in feeding and require special attention. Mobilization. The family plays an important role in maintaining the mobility and self-sufficiency of their sick loved. As physical conditions change, family members can help the sick person to maintain autonomy in daily life activities, eating alone, washing face and hands, etc., and avoid being bedridden. People close to the patient can get small massages and mobilizations of the limbs, thus helping him to maintain muscle strength, or have walks together in order to promote walking. Helping and stimulating your loved ones to move, if they want to do so, is important not only on the physical level but also on the psychological one. Even a few steps can be important. Maintaining or improving physical abilities can help your loved one prevent problems resulting from immobility such as bed sores, or in some cases it can help reduce pain and consequently improve the quality of life. The room. It is the room in which the patient spends most of his/her time. For this reason, it must be prepared in the most functional and welcoming way. The bed must not be so high as to hinder the patient in getting on and off. The room must not be far from the bathroom, otherwise it is appropriate to place the patient closest to the service. Some accessories are indicated: side rails to prevent falls, the bed blanket support that eliminates the weight of blankets on feet and ankles, the trapezium or a bandage attached to the bottom of the bed, ending in a ring, which allow the patient to rise. Increase the room temperature rather than using too many blankets or an excessive number of clothes. The patient with a very reduces movement possibility can use a wheelchair, crutches, or a tripod cane. To facilitate movement, obstacles such as protruding furniture or carpets must be eliminated. Architectural barriers, such as stairs or raised floors, can be easily overcome with wooden or metal slides. Management of the main symptoms. Pain. Pain is a complex sensation that derives from a perceptive component linked to the transmission of the painful stimulus to the brain and from a component linked to the experience that depends exclusively on the subject, that is, on the way in which each person perceives and experiences the sensation of pain, the so-called pain threshold, i.e. the limit beyond which a sensation becomes painful. The main thing to know is that most of the pain can be controlled, and not all sick people need to feel pain. There is a wide variety of medications that can help control it. Healthcare professionals evaluate how best to contain it, how the person perceives pain and how it affects their quality of life. Tips for pain. In order to be able to better control the pain, it is necessary to carefully consider a number of aspects. When it appeared. In which zone? What intensity? If no type of communication is possible, there are several signs and alarm bells that can help, including changes in breathing, changes in mood, agitation or increased temperament, lack of concentration, withdrawal or refusal to make eye contact. Dyspnea. Breathlessness, or dyspnea, is the uncomfortable feeling of take your breath away. Living with breathlessness can be difficult, and often make it more difficult to manage simple daily activities. The person can try equipment such as walking aids up to drug therapy. Controlling your breathing can be really helpful when a wheezing episode is present. Slower and controlled breaths must be done, using the lower chest while keeping the shoulders and upper chest relaxed. The goal is to reduce the effort to breathe and better manage breathing. Fatigue. Fatigue is a feeling of extreme tiredness, weakness, or lack of energy and is very different from normal fatigue. It can affect many aspects of life. Possible signs of fatigue are sleeping problems, problems with short-term memory, Feeling of heavy limbs. Feeling drained and without energy. Difficulty completing daily activities, such as washing and dressing. Difficulty concentrating and making decisions. Lack of motivation and non-enjoyment of usual activities. Depression and anxiety. Tips for fatigue. Planning the activities to do during the day when you feel more energetic and avoiding doing things that are not essential can help to maintain family habits. Taking daytime naps and, if possible, sitting down to do tasks, can help save energy. Rest and sleep are important, but if you are not very active during the day you may have difficulty sleeping at night. Following a routine, such as getting up and going to bed at the same time each day, can improve sleep at night. Stay active as much as possible, without exaggerating. Moderate exercises, such as taking a short walk, can improve circulation and give you more energy.